Farm so hard the employees wanna find me and then wanna hire me. What's 100K to a guy like me? Could you please remind me? Farm so hard, this ain't easy. Working late nights, you best believe me. My grades can only go A's. Never wanna see another B unless I'm Jay-Z.
Thank you guys and welcome to another Pharm So Hard Fun Under the Sun event. Of course, it's just one of the much of the boring part, I should say, or the more talkative part, but we're gonna try to make it very interactive and fun and just have a good time. Again, we've talked about this before, but we don't want this to be anything that's like you're sitting in a lecture. It's more so of us just having a good time, having a few beers, talking, and then we'll figure out other things we can get into after this. So of course, for you guys who I haven't met before, I'm Jim Pruitt, founder and the host of Pharm So Hard, and I've come all the way from Charleston, South Carolina, a 3-hour drive to Charlotte to come out here to sunny, very surprisingly hot Denver.
300 days a year,
So super excited. Everyone that's joining us in Zoom, thank you guys for coming. And again, anyone who's watching this after, welcome. And we're super excited to be here. But we're going to talk about something a little unique. But before we jump into the episode, we're going to introduce everyone on the panel. I'm a guest here. These are the men who's been here for a while, taking care of things. So Lance, go ahead and kick us off.
Hey, Lance Ray, clinical pharmacy specialist at Denver Health, just a couple blocks away. I've been there 2 years. I'm the residency program director for the PGY2 Emergency Medicine program. I was at University of Colorado, emergency department for about 4 years before that, and then out for 9 years in Texas, emergency medicine, as well as an assortment of other things. Trained at University of Texas and the Health Science Center in San Antonio.
I can go next. My name is Andy Kim. I'm also a clinical pharmacy specialist at Denver Health, but I practice in the medical ICU there. I'm originally from the Kansas City metro area, born and raised. Did my undergraduate at the University of Kansas, pharmacy school at University of Minnesota, and residency training at Frederick and Medical College of Wisconsin. So both first and second year critical care residency. In terms of my role, obviously at Denver Health, I'm the primary pharmacist in our medical ICU, and I also serve as the PGY2 critical care residency program director, and we've had our program since 2016.
All right, so I'm Tony Mixon. I grew up in Lansing, Michigan, made famous by my Magic Johnson, who went to my high school. I did a PGY1 here in Denver at Presbyterian St. Luke's, and then went out and did a PGY2 at the University of Chicago Medicine. My PGY2 was in infectious diseases, so a little atypical for the ED setting, which I'm now an ED pharmacist for UC Health North. I rotate through a couple of places: Greeley Hospital, Medical Center of the Rockies, which is our new level 1, and then Poudre Valley Hospital.
Perfect. So let's jump into it. The first topic we're going to talk about today is burnout. This is something that everyone's talking about. With 14 or so days left of residency this year, everyone's probably feeling, again, even from the preceptor side of things, I think part of it we're pretty burnt as well. But let's just go through a few of the questions. And again, if you guys have different questions, please reach out. If you guys are on Zoom in the chat, please reach out to us as well. But I want to talk about next, everyone here, what does the term burnout mean to you? Because it's a cool thing to say now, but what does it actually mean from you? And Lance, you can start us off and let's go.
Yeah, I think of days when I just don't have the energy to put forward. And I think that sums it up for me. Just kind of tired and tired in the wrong way, right? Tired to where you're not interested in. And I told somebody this that year. I told Gabby over at university, it's like, no, I wasn't interested in teaching. Wow. She knows how much that means to me, right? How much teaching means. And I just lost the drive for like a week there. And I had never done that before, right? And so I don't know. That's big. That's big for me, to lose a drive for something I'm so passionate about. And I had to kind of step back and fix that. So it's an example of burnout for me.
Yeah, I think you nailed it right on the head, Lance. It's sort of that thing where you have this passion to do all these things, in your job, and for whatever reason, you just don't want to do those things anymore. You're stressed out. Maybe it's from work, maybe it's from outside things, and I'm glad that we're talking about this today, because it's obviously something that we're hearing more and more of. Obviously, the pandemic sort of accelerated those things, and these were obviously issues prior to that. But certainly, to me, I think of burnout like, it's like this metaphor where I'm this like candle, out in nature, and there's all this wind trying to like, put you out, and you're kind of just like hanging on by a thread and trying to figure out how do I balance, all of these things that I'm juggling in order to like, do well in my career, but also do well in my personal life as well, and kind of balance all those things.
So when I started thinking about what burnout meant to me, Jimmy, like the first thing that came up was just sick of the bullshit at work. Figured that wouldn't be great for this podcast.
Oh, perfect.
So I went and looked up the ICD-11 definition of it. And basically what they talk about is that this is an occupational phenomenon. And it's a syndrome conceptualized by chronic workplace stress that's not being managed well or appropriately. And it can manifest in all the ways that we've already talked about, the things that we see in each other and our colleagues, of feeling completely depleted of energy. Increased mental distance from your job, which is one I've definitely been guilty of in the past. And then the third one they talk about is reduced professional efficiency. So just to bring a little science to the original comment.
I think for me, a lot of because my job and my hobbies are all pharmacy related. So it makes it to where there's times where I feel, initially it was like I felt guilty all the time for not doing something. So I think as residents, as you guys graduate, the first few months are always tough. Like you feel like you should be operating on that standpoint, but after a while it goes away. Unfortunately for me, I kept that going for like 3 or 4 years after residency, but I think COVID really took a big hit on me, and I worked at 2 EDs. So I worked at Grady in Atlanta and also in USC in Charleston. So there was a period of time where prior to going to MUSC, I was in Augusta, which is a 2-hour drive. I had a 7-on, 7-off shift. And I would do my 7 on in Augusta, then I would go to Grady and do like 5 on. And when COVID came, there was a lot of people who were getting sick and they needed more help. So I remember the month of July, I worked every single day. And July 2020, I worked every single day. And I think back to that, and I know it aged me in dog years. It absolutely aged me in dog years, to the point to where I didn't look back and was like, okay, I'm definitely not doing this anymore. But I never recovered. Never recovered mentally and physically from that. And now it's to the point to where I try my best to completely cut off at times from pharmacy. And the bad thing is, like, I don't have one hobby as pharmacy. I don't have 2 hobbies. I have 3, 4, if you include all the other components. And now it's like, how can I still provide value in the things I do outside of work? And what I've noticed is that sometimes at work, I'm just not as excited to teach. I'm not as excited to be there. And little things aggravate me. The patient that comes in every day that leaves AMA, it frustrates me so much more at this point of the year compared to, a year or 2 ago before I really started getting to this point.
It's interesting you said you never recovered. So I was going to ask, like, well, you're fine. You're here now. You're fine now. You're probably doing fine every day, but right? You said like you never quite recovered from that. And I think that's something that we think, and I see younger pharmacists that do 7 on, 7 off schedule, and they'll do PRN on a different job a few days a week, and I think it's important to remember, yes, we're resilient. Yes, when you're young, you're resilient, but I think it's important to realize that can still happen. It can affect you. It can stick with you. Right? I've seen that happen from some of our learners here in town. That they graduate, they're go, and they're excited, and they want to fulfill the full clinical pharmacy role and all that. And my advice would be to watch out. Right, take it easy.
Mm-hmm. Absolutely. I think it's pretty common for residents to work like 12 on, 2 off kind of situation. So you get out and then you're making a significant amount of money and you're like, well, this 10 on, 4 days off is the life. I've got plenty of money. I got double the time off. And I think we could do a better job of educating people on the fact that that's just not sustainable, most likely.
And it carries over, it carries over into all aspects of your life. I was an athlete, and I remember doing PGY2. I think I got the smallest I've ever. I lost like 20 pounds. And I used to pride myself on just working out, eating well, doing these different things. And I remember my wife was showing me a picture. I'm like, oh, that was me doing residency, huh? And we used to get so used. And I think as a community, there's some things we have to do as pharmacists. And I really want to go around as one of the things part of this tour. I want to ask people, how can we get better at this? And that's like the next step I want to go into, is figuring out, like, we talked about some well, before I get there, I want to ask, what are some contributing factors? Because I think different things hit us, and maybe sometimes working at the bedside is it, but the things that really grind my gears is like some of the things that are non-patient care related. So in the best way we can say it while having a job when we go back to work on Monday, what are some contributing factors to burnout for us?
I can get started off on this one. So I think we go through a lot of the things that all healthcare workers do, especially the ones in the emergency department and the critical care areas. We work in a very high stress, high pressure environment where we're making life and death decisions very, very quickly. There's got to be a certain amount of trauma for all of the horrible things we see. And I think part of COVID contributing to a lot of our burnout is that was increased by magnitudes, right? But then there are some specific things to pharmacists and acute care pharmacists. And I would point out Megan Reck's publication, I think it was The Premature Attrition of Clinical Pharmacists, as a really good reference for things like that. So she pointed out things like the inability to generate revenue for services that we provide, which is absolutely true. I also look at public perception, and I always remember the story of like one of my worst days of PGY2. So my program had a 24-hour in-house on-call program. So I was the on-call resident, was expected to run with the immunosuppressed ID team. I had the antimicrobial approval pager for those things, and I just got rocked that day. And I talked to my dad, and he's like, "So you're 2 years in, you make less than other pharmacists. What are you doing?" And it's not like I had not told him a million times the plan and the idea behind this. And if we can't convince our parents of this, what does the public think in general? And then you move that up the chain. And I mean, administration doesn't always have a great idea of what clinical pharmacists do. And that includes pharmacy administration, sadly. I think we could definitely do a better job of getting that perception up. There's also, Megan pointed out, and I totally agree with this, little upward mobility. We get all this training, we land in these jobs, and we do all this great stuff, but where do we go from there? And I think historically, we see people who do well go upward. And I'm not sure, I'm willing to be a manager. I'm not sure if anybody here wants to go that route. So there's not much of that. And then lastly, just work-life balance. I mean, in pharmacy school, I was taught, you're a pharmacist, it's who you are, it's what you are, it's what you do. Residency got even worse. And I got out of school and out of residency and thought, like, what are my hobbies? Yeah. What else is out there?
Who am I?
Exactly.
Who am I?
I know I'm a pharmacist, but there's some cool stuff around here I really want to explore.
Yeah. What do you think?
Yeah, I echo a lot of the things that you said, Tony. And for me, kind of going through that list that you kind of laid out there before, it's like, how do I get it all done, right? Lance can probably talk to this too. It's like, okay, we have our normal areas that we work in, but then we also direct residency programs, and where do you get time buy down for that? So making sure that you have adequate time sort of off service in order to be able to juggle all these things is super important. And when you don't, you just feel super stressed out, and that just builds on top of each other, and that probably just accelerates sort of that burnout feeling. You kind of talked about mobility as well. Yeah, totally. Like, who says that as pharmacists there's this like track of mobility that you have to go from a bedside clinician to a manager? Yeah. Maybe that's not the right way. And maybe there's like other things within pharmacy that we can sort of branch out to. Obviously pharmacists have like tons of skills that, we train in and learn. And these are things that we can definitely apply to outside of just, those finite types of positions.
Yeah. Nice.
Yeah. And I think, something about the model and just kind of what we do as pharmacists in healthcare and lots of other spots within healthcare are sort of by nature revenue generating, and pharmacists have always been sort of cost avoidance centered. And gosh, I think that as your mode is sort of just is built for burnout, right? Like, all I do is avoid costs, save money, and enhance patient care, but in all these ways that you can't really, think about the things that we do every day, and you can't document them. If you do document them, you'll be spending hours charting every night after you get home, and that's not what we do, right? But so it's this kind of inherent kind of like kind of trench that we're in to where we kind of along with kind of public perception, what a pharmacist does. You can't, I'm a pharmacist, and, oh my God, you're saving lives left and right. It's like, the public, I'm 90% in that paper too. They think that you're, counting pills and doing certain things. But yeah, okay. So on top of all the clinical duties, right now, okay, now you have a teaching role. You have to take students, precepting. There's a pressure to do research and scholarship. And so it's very, it's inherently a tough role.
I think you look at all that and you realize, I put myself in a unique role where, I'm a residency mentor, I'm a residency preceptor, I'm a coordinator, and doing these things for my job. And then I think about my role for the greater ED acute care community and the things that I do in podcasts and trying to advocate for us. Where does it stop? Where does it stop? What are the things we have to do? What are other things I have to do? And who respects that? I remember the funniest story. I remember I was talking to someone. I was like, I work in the ER. I try to make it as simple as possible so they don't ask, because it's going to be wrong every single time. And I remember it was like, what are you doing at ER? I was like, I'm a pharmacist. Like, oh, so you must count pills like really fast. And I'm like, okay. And I remember I was out with one of the ER residents, and his wife was a SICU nurse. And I'm like, oh, obviously you know what I do. And it's like, you keep those crash cards filled, don't you? I was like, I don't replace the crash cards. Like, you're a SICU nurse. I'm like, he's like, no, he doesn't do that at all. Like he's like, saves my answer. That's what he does. Like, it's so challenging to have that as a perception. I have a certain level of frustration from a advocacy standpoint on Capitol Hill, to be honest. I've been getting that same email about provider status since I was a student. If we can't build, we can't do the things that show the value. And unfortunately, for the greater public in the C-suite, dollars matter. And if we're not able to reduce that, I'm thinking about culture callbacks. I'm thinking about the time we put at the bedside from a toxicology standpoint. All the things that we're doing that are like consults that we get, all the kinetics, all the things that we do. Everyone else in the hospital system bill for those things.
We just say we avoided some costs.
Like, cost avoidance is like, it's great. Like, how many studies I can count off my hand. Again, people here have produced studies that said $1 million, $2 million, $6 million. We've saved this. Our mortality has decreased. We've done all these things. Our compliance with guidelines are better in every disease state. Every pharmacist and every physician in acute care. You start adding on pharmacists and specialty pharmacy everywhere else, is they're finding a way to do these things, but we're just hanging on by a thread. So that's frustrating. And that's what made me really want to focus on how can I push from a different perspective. Like, should I publish research, or should I travel the country and figure out what people are doing and highlight what we're doing as ED pharmacists, as acute care pharmacists, and really show what we can really do if given opportunity? Like, what should I spend my time doing? If I publish 100 podcasts on things that are valuable and getting guests from all over, is that just as important as a review paper? So it's frustrating. And then when you speak with administration, some people have administration that understands. Most that I've been able to communicate with do not. They don't know what I do in the ER. They don't know what I do. They say, you verify this many orders. Like, well, I can point to you a patient that I made a recommendation on in a cardiac arrest, and they walked out of the hospital a week later. And the entire team said that recommendation is the one thing that changed the patient from being dead versus being alive and walking out. Like, how you put that on paper? So it's frustrating when the things that you got into this profession for, what really makes you feel good at night. When I went home that night, the provider said, make sure you tell your family that you saved someone's life today. And I never forget that. But I tell my administration that, like, well, how would you do that? The physician knows. It's like, so long story short, there's a few different things. Just misconception, not advocating, and we need to get paid for these things. We need to have an additional ladder to be able to go not just within pharmacy and just do bedside management.
Yeah. Because
now with the admin residents, and it's admin resident, give me, but you're not getting to be like an assistant director, a director for the most part in these bigger healthcare systems that most acute care pharmacists are in. Most acute care pharmacists are associated with the University of XYZ.
Yeah.
And most of the places have administration residents, and they're going to get those positions with, 12 rotations of experience.
I'd be interested to know. So public perception is really bad. Does anybody have any ideas on how we can fix that outside of what's been tried? Just spitball in here.
I'm not sure there's a magic bullet here. I mean, we clearly have all these studies that say, wow, pharmacists are really burned out, but no clear guidance of, well, how do we fix that? And, it's a multifactorial problem. And I think from like an acute care perspective, it has to start from the top. Like it has to start at the top of your leadership and has to trickle down that we have to change the culture, right? The culture of trying to do too many things with limited time, with not enough resources is not the best model to do these things. And so, how do you do that? Logistically, I don't know, but I think it's multifactorial, and it has to start with, your management or leadership team and or from your department from the top down.
Yeah, it's certainly multifactorial. And Jimmy, you mentioned, provider status, and this is saying, and I've been at it for even more years. I've listened for even more years on the promise of provider status. And some say, oh, we've got it in the state and that's it. It's just really there's a lack of it overall, right? There's a lack of legislation and it's just, we're so confined by regulatory statutes. That's the nature of our business. But I think that would be one super helpful thing. But also, this public media perception. We're just hospital pharmacists, clinical pharmacists are sort of hidden. Jimmy, I was just thinking, you said you've got a lot of energy focused towards with media. You've got a lot of energy. I'm thinking, what if you create like an ER reality show, or ER for just
Here we go.
Forget the physician reports to the pharmacist, right? And everybody else does, and it's somebody, but it could really highlight that. I don't know. We should work on that.
It's just intriguing because I think about this. I'm gonna try my best to not ruffle some feathers. There's papers that are written and designed by pharmacists, 90%. And we're not the primary author of that paper. Someone hands us this, I need your help with this. And you do all the work, and that attention, that credit, those awards, those research dollars and funding goes to other groups. That happens quite often. I spoke about this at SECM last year about how, again, we're doing all this work and we're the group that's like we're the nerd that does the homework for the jock and turns it in for him. That's what we are. Like we're actually doing all this stuff, but then now it's getting to the point to where, okay, I want my recognition too. And unfortunately, I should say fortunately, recognition is going to be recognition for services billing. One. The second part is we need more lobbying to the right people, because obviously that's where all this is going. So there's certain organizations that a lot of people are paying dues to every year. And I want to know where those dues are going, or I would like to see how can we push those dues to wherever everyone what an AMA is doing. You can't do anything without an AMA publishing a report. I remember
Paxlovid,
they said that they are best suited to take care of the 52 pages of drug interactions. If there's any clinical pharmacist or any physician that's here, I've never heard them say, Jimmy, you can sit this one out. I'm gonna take care of this drug interaction. I've never heard that before. I've never heard them say that. And now I'm looking at myself like, why wasn't there something big done? We wrote a letter to them. We told them we don't stand by that. It's all inclusive. And it's like, when something happens for the nursing association, they knock that down. When something happens in the medical association, they shut it down. We're the only one. We wait a week or two, and it's a very kumbaya message about what should happen. And the way I'm looking at things, and we talked about this at the Empower conference, is that I want to start again, at least within ED pharmacy, organize ourselves into a position, make sure we're punching where everyone else is punching. We're putting our mouths and our dollars where everyone else is doing it to get us the respect and then put us where we deserve to be. We're not trying to overtake anyone in their position. We need to be where, if there's medications involved, I believe the pharmacist should be there. Every guideline that has a significant amount of drugs involved, a pharmacist should be there. So that's one thing for me.
Yeah, and being proactive rather than reactive.
Yep.
That's the key value. Some initiative.
You kind of named those two organizations that have a ton of lobbying power, and how do we, combat that? Is the big question.
They come together to have one focus. Like everyone should just say, okay, no matter the National Association of blank, blank, blank pharmacists, everyone come together. We want provider status. How can we do that? Not in rural areas only where the majority of our resources are not there. We want provider status across the board. Across the board. And if you look at that provider status list, there's people who are in a variety of professions. But I say that with our training and our skill set and the things that we provide at the bedside, we deserve to be this way. I'll keep it simple as that.
Absolutely.
All right, I want to go from there. Let's talk about some things that we've done to help, some ways that to prevent burnout for ourselves. We all have different things that, again, this is not an ending cycle. For me, burnout means like, what can I do for this week? How can I make it better for this week? What are some things you guys are doing in your personal lives, or what are some things you guys are going to recommend to your learners, some strategies to help them, make this a marathon and not get burnt out halfway through?
Yeah.
Stop taking students. Absolutely not, right? So we can't do that. We can't stop taking learners. I think, there's an art to precepting in a creative fashion, right? And I think we all know that. We all try to teach that too. But precepting can be tough. It can be time commitment. Talk about it can be a time commitment. So it's I think being creative about it and picking tasks and just trying to integrate learners into the department, giving them a lot of more. A lot more capability, I guess, for lack of a better term, giving them, letting them take the initiative on some stuff. But aside from that, as I mentioned that earlier in the section, but I think mentorship is really important, right? In terms of young pharmacists, even senior pharmacists, kind of finding mentors, finding friends to talk about burnout, to talk about how it's tough, how can you fix things? Andy and I talk, on a somewhat regular basis, more and more about this, and like, how should we down our necks on this and that? How can we do this? How can we make things better and keep ourselves sane?
Yeah, I think there's some pretty, easy small things that you can do on a practical basis. Like, if you're not at work or you're on PTO or you're on vacation somewhere, don't check your email. Don't respond to things that you don't have to urgently respond to. I think that's an easy way to sort of keep yourself sane and separate your personal life from your work life. Additionally, it's okay to say no to some things. We're all busy people here, and I know we get asked a bunch of different requests. Say, hey, can you help work on this protocol or this guideline? Or hey, can you do some of this research? Can you look at this data? We're all human here, and I think it's we all have our limits, and it's okay to say I kind of have too much on my plate right now, and I'm not sure I can get to this. Maybe in the future we can revisit doing this thing.
So I've got kind of a tangential story, but stick with me here. I'm gonna bring it back, all right? Because it is one of the things that really helped me with burnout ultimately. So year out of PGY2, I'm reading the book. I think it was Outliers by Gladwell, but it has a section in it about Alaskan sled dogs, right? So for the longest time, for decades, they're breeding these sled dogs, the ones that pull a sled to win, like the Iditarod. They're breeding them for size, speed, strength, all the things you'd think of. And they did this for decades. And the best breeders typically won. They got to a point where they were having kind of incremental increases in how strong these dogs are and how well they would pull a sled. But some of the best breeders, and I don't know, you call them mushers, sled dog drivers, whatever you want to call them, noticed there were still differences in these dogs. And it was more of a psyche. There were some dogs that were just very high motor, that wanted to pull that sled, that needed to pull that sled, that were uncomfortable not pulling that sled. And those mushers tended to win because they started breeding for that aspect. And it was at that moment when I thought, holy hell, I'm that dog. I need to go. And when I experienced burnout, And when I experience anxiety and things like that, it's because I'm somewhat idle and not really working towards anything. I feel like a lot of it, obviously you, but a lot of us in this profession have that issue, and we have a hard time being idle versus working on something meaningful. So not only is it something that's very important to me, so I do this in a very literal reason or way. I tend to mountain bike, ski a ton, trail run a ton, and that's one of the big things for me. But it doesn't necessarily need to be something physical. It can even be tied into work to a degree. I've had times where preventing burnout for me has been working on a study in a reasonable time frame, knowing like, hey, I've got patient care duties, but in the background, I've got this study that ultimately helps me to feel a little more well-rounded, feel like I'm doing something meaningful, and not feel idle, most importantly, because that's a sign of burnout for me. So talk to my learners, colleagues, things like that about that quite a bit.
Those are big things. I jotted a few things down as you guys were talking. And a few things came up for me because if you guys haven't noticed, I have ADHD. Shocker. And I have to go. I've always had to go. I've always, again, when I play football, that was just one of the things like, oh, this guy's he's not gonna get tired. He's gonna be very aggressive. He's gonna do his thing. And I've always wanted to just strive after something. So it was normal when I came from football to pharmacy. I was like, oh, okay, people here are not the same. They don't know what it's like to wake up at 3 o'clock in the morning and do these different things. Like, I'm really gonna crush this. And I'm noting to myself, like, year after year, like, I'm still keeping them up. I'm still keeping up. I'm okay. And then, of course, COVID changed a few things. And I noticed I can't continue to do this and spend time with my family. I can't continue to do this and not spend time. So I think one of the things that I've noticed, spending time and being there is different. I can be there and on Twitter, oh yeah, you can go run around and do those different things. I can do that. But like, I've now gotten to the point to where I'm just not doing anything but what's in front of me. And that's helped me significantly. I'm like, oh, I forgot I have to go to work today because I'm so involved in something else. And now I've compartmentalized all these things to where I'm not checking my email. I'm not going to do anything. And one of the things I've learned to do is that I get very excited when I have an interesting project. And I notice the time frame that I think I can do it in, now I double it. So if I think I can get this done in a week, I double it. Or if I want to meet with you next week, I meet with you the week after that. So I keep pushing these things back because I noticed that my excitement wears off and then like the reality kicks in, and I notice whether I want to do that or not. And I've now gotten to the point to where a lot of people ask me to do stuff now. The more people, the more of the brand has grown, the more stuff is happening. Like, oh, can you make this for me? Can you visit here? Can you come there? And I now say, I'll get back to you in a week. And I put a pause between the need to act and not, because we're great at acting right now. Like my best moments is like, Jimmy, oh my God, go to room 1. Patients came in there. We don't know what's going on. Get in, do those things. I'm phenomenal at that. And I'm like, okay, now let's take that and pause and leave that skill where it needs to be. Now let's figure out what's going to be sustainable. Because I don't think the way I was practicing last year, especially in 2020, I don't think that I can continue that for 10 years. And I love this. I want to be a pharmacist since I was 16 years old. I knew within 1 hour of my first app utilization, I want to be a leading pharmacist. So I'm one of those guys where oh, that's it. I know it. This is it. Oh, that's for my wife. Oh, that's it. There you go. That's it. So it's like one of those things. So now I'm looking at all these things. So like making sure you don't take these things too far and separate. So where when I'm at MUSC, you get it all. As soon as 11 o'clock comes, that's it. That's it. I'm not working on a project at home. I'm not answering an email. And you may think I'm a certain, whatever you want to call me for that, but that is it. When I'm working on my platform, I've now got it set up to where Pharm so hard, you get this period of time. And that's it. When it's time to relax and do things, I try to give myself these time frames and block those things out and work in certain blocks, because if you don't, you're just always going. You're always going. And we're not built that way.
Yeah, protecting time, your own times, but Andy mentioned, I don't know it's a common theme here, but also, Jimmy, you mentioned something, I think it's realistic time management, right? And it's kind of a learned skill. We all want to please, right? And it's sort of the nature of the clinical pharmacist role, right? We were kind of, we wanted to we want to perform, we want to make everyone in the room happy. And I think that carries over to project management, and I like your strategy there, right? If I think I can do it in a week, let's say 2 weeks. Give yourself some breathing room, right? And I think we too often sort of commit, and then it puts pressure on ourselves. And a lot of us are sort of perfectionists,
And it doesn't matter really. At the end of the day, I think about it. Is someone gonna? We get to see this often. Is someone gonna die because of us not having this project happening this time? No.
I think we get locked into that residency time frame, you
It's
know?
like, well, like, I haven't been in residency in years, but I still like, oh my God, Pharm academic's gonna get me. So a lot of times I have to take a step back and ask us like, does this really matter?
Yeah.
Like we're expert at identifying something and figuring out what's the impact going to be to our patients, to our teams, everything else. But realistically, does it matter? And then does it matter the way you think it does? Does it matter the time you're spending in the office doing that versus time you can be spending with your family? Does it matter like not going on vacation for years? Like I think back now, it's like COVID taught me. Because I was like, I had never been on a vacation my own until I went to Vegas for 2 days in 2019. And I told myself, after that, I'm going to go on vacation and do all these things. And COVID happened. And I couldn't go anywhere. And then it's like, okay, now I'm nervous. All right. Now I have another kid. It's like, okay, wow, one couple months can turn into 3 years like that. So don't push it back. The things that you can see and do now, and like, does it matter at the end of the day? And I think it's different now. And I think that's things that help with burnout for me. And I tell my residents, give yourself time and grace. Like complete the project, yes. If it has to be done, yes. But outside of that, I think pharmacy has made this fake world where none of our other colleagues have to go through. Like other residency programs that are doctoral in nature, they don't do the type of research projects that we're required to do and push out the stuff that we required. I think Frank in Chicago, he talked about this. Many people have many opinions about our required research projects and manuscripts. I think research is important. I think the manner in which we do certain things is interesting.
No, I totally agree with you there. And it's like, maybe we need to take, a deeper look in, our residency training requirements. It's like, what are the things that are really important? Like when your resident comes out, are they just going to do projects all day long? Mm-hmm. No, they're going to take care of patients, right? So you want to provide them with the most meaningful experiences in a very short period of time. And that may not be, do 5 MUEs.
Yeah. I know it's one girl on Twitter. I don't know her name. She's like one of those like anonymous people. Like she's famous for complaining about residency.
Flawless Pharm.
Flawless Pharm. Shout out to her.
I've seen that.
Like she's like built a platform based off this. Whatever residency she goes to, I feel bad for because it is like it must be. But it's like you think about that, and like part of those things are like true. Like part of how it makes you feel is that way. And I think about the things from residency that I really value, and it's like I never remember thinking, "Oh my God, I'm so happy at this MBA." I remember being at the bedside and like someone saying, "Hey, do this." I'm like, I don't know what I'm doing, but okay.
You didn't enjoy sitting next to like a half-done poster at mid-year? Well, nobody comes by.
Yeah, meeting and like your preset walking by.
Yeah, your suit looks great.
And yeah, we can't reimburse you that whole $500 you paid for registration. Yeah.
Yeah, the emphasis on project and research is sort of disproportionate, right?
Yeah.
It's like, okay, take all 70 or 80 PGY2 EM programs, right? Maybe, gosh, it would be cool if you could, split off, like maybe you could choose to whether your PGY2 EM program is more of a research, academic focused one or not. Because we all know there's a lot of community-based ones, and you might want to apply to a program that's a little less research-based, or you want to apply to one that's more research-based, right? But how many other professions that have a 1-year residency or a 2-year, post-grad residency program are required to do this many projects and publish and all this stuff, right? A 4-year emergency medicine residence is one of the best in the country, right in the street. Throughout their 4 years, they're encouraged to do a major project. They don't have to. They're can get involved with research if they want to, but you can go through the whole 4 years and focus on something else.
Yeah,
it's 4 years, right? And we mandate that all of our residents do a major research project and get published and all that, and that's great, but it's disproportionate, and I don't think it should be required.
And correct me if I'm wrong, because I've chosen to do podcasting and not research. So how many? What is the percentage of all residents research project that gets published?
I'm 0 for 2.
They'll even go do 7 on 7 off.
A publication suitable.
Yeah.
Suitable publication. Like I submitted my PGY2 project 3 times. I'm like, I thought it was pretty good. For someone who's like that do research, I was like, this is actually pretty solid for me. Like, I'm actually proud of this. Deny.
Yeah, how many years to sit on a shelf somewhere?
Yeah.
Wait to get dusted off.
It has to be less than
That's
5%.
okay. That's what I'm saying. It's okay.
I would accept that. Yeah.
I was like, it has to be less than 5%. And like our focus thing. I have a Pharm academic evaluation right now ready for me for a research project and then another project that was, but all the vet side stuff, I don't know even where to put that. So it's intriguing.
Well, and if Frank is here.
Okay, we'll see him in 2 weeks.
So Frank will tell you that, a lot of the research projects are doomed, and projects are sort of doomed because people and residents and researchers aren't asking the right research question. And I've seen that, I've done that. I think because you got 1 year, you got 12 months to do a full, thing. It's a tough timeline, a tough project.
And I'm gonna just be honest, most of it's trash. Let's just be honest. And like we do it because we have to. We submit the stuff.
You absolutely have to. There's no option.
I'm not gonna read this. I'm gonna be honest. Like I feel bad. I'm just gonna put it out there, and you guys may hate me, and somebody who's like really big into research may hate me. But most of these studies are like,
It's because that's what you can get done in 12 months.
yeah, and that's the quality you're gonna get. Okay, we're gonna digress. We definitely tackled burnout and how poor research is, and then interestingly enough, we'll be talking about research and pharmacy education in Chicago in a couple of weeks. So we'll continue that conversation there.
You're making me want to get my co-listing PGY2 project published now. I just need a few drugs to go out of favor.
All right. Any last words on burnout, guys? There's a few things we can do. Just to summarize everything we've kind of talked about. It's just focusing on the things that really matter to us, saying no to things that you don't have to. Time management is going to be key, and focusing on the things that you really want to, that gives you passion. There's a lot of things that I'm now looking more into real estate. I've gotten into stocks. I've gotten into all these things that I knew nothing about because I did not have time. Like the only thing I had time to do is understand the history of in 1906 when Effie was first getting into a dog. Because that's my reason.
There is a big world outside of pharmacy, and we get wrapped up in it. And
It certainly is, yeah. And I think, us as like, preceptors or, RPDs or, what have you, your association with your residents, it's like, we can model good behavior. And we can teach like what is good balance and encourage residents to go take PTO, take all the PTO that you're allowed to during your residency year, like go have fun too.
Yeah.
This is like, this is a short period of time. We're going to learn lots of stuff, but at the same time, like you should have fun too with it.
I think we spent all this time. I think you really go through most of your 20s preparing and training for this. And it's always one thing after the next. And what I usually see no one talks about is I call it post-graduation depression. Who am I? What do I have to do? When I was in pharmacy, when I was in undergrad, I wanted to get to pharmacy school. I went to pharmacy school, I want to get PGY1, PGY1, PGY2, and then you're supposed to get a job, and then you're like, oh, I have no hobbies.